Okay, welcome, welcome. We are so very excited to launch the Clinical Medical Assistant Program at Southeastern Aesthetics Institute. If you are looking to make a difference in the healthcare industry and really make sure you put your mark on what sets the standard and the tone for patient care moving into this year, moving into next year, moving into many years from now, then you are in the right place. We are so very excited to launch this program, and I can't wait to share with you right now all the fun details about it. So we're going to go through every little thing year week by week, and I hope to paint a really fun picture for you about what you're going to experience in the classroom. So really quickly, take a look here. Your clinical medical assistant program at Southeastern Aesthetics Institute is 20 weeks in length, 600 clock hours, Monday through Friday, 9 a.m. to 3 p.m. You will have some externship opportunities that we will get into in just a moment, but I am excited about this one. I have spent a long time putting this together in a very sequential order. And so we're going to go through that order. I like for everybody that comes to my school to know what to expect. And we do that by offering you a very detailed day-by-day syllabus. I am also one of those that loves to provide you with incredible on-site education, not only in theory and practical, but we've also got some fun technology opportunities for you through the National Healthcare Association as well. And we're going to offer their national exam to you. So this is exciting. And I just want to begin by showing you your giant textbook. So I'm a big believer in making sure you have a really fantastic textbook to go through in addition to some of those fun digital learning opportunities. So we'll talk about the NHA stuff in just a little bit, but this is the KENS Medical Assistant textbook, and you're going to have their most updated version of this, by the way, their most latest edition. So we have all these amazing teaching resources for you, but this one I like a lot because it not only goes through everything you need to know, but we're going to go through all of the procedures as well in the textbook in our laboratory for you. So follow along with me here. This is your exact syllabus for the program. We're going to dive right into it. I'll make it a little bit bigger here. But if you look where it says in the blue highlighted section, core and then elite. So we have two sections of this program for you. The core section is week 1 through 15. So in that segment, you're going to be in theory class from 9 to 11. This will be a lot of fun. We just built some brand new, incredible classrooms near our stage area. So super excited about that. And then you also have got your theory again from 11:30 to 12:30. So we have a little 30-minute lunch break for you there right at 11 o'clock. So I like to call that brunch time. So you can enjoy that little moment. And then from 12:45 to 3, you're going to be in the laboratory. That laboratory can be based on either hands-on labs or in the computer lab. Okay, so we're going to integrate some of that fun NHA, National Healthcare Association content for you in our computer lab. And those are two separate labs. So our clinical lab and then our computer lab, you're going to love that. So it makes it super fun. Super hands-on. You get to change things out. Nothing is ever the same, so that's really the cool part. And then when you're in that core section, we get to know who you are, right? We get to know who you are, what you're about, what you're interested in. And then based on that, we really help to pair you up with a clinical externship opportunity or opportunities plural that really help you be where you want to be. So we'll push you a little bit too. If you don't know, we'll kind of place you in various places that specialize in different things. Or if you really, really know you want to specialize in a specific type of CMA opportunity in medicine, then we'll put you there, So this is where we get to know you so that when you get to that elite section, week 16 through 20, you will be prepared for the clinical externship opportunity. Okay, so this is exciting. So we not only pair you up with this, but we also make sure we ourselves, the team at Southeastern Aesthetics Institute, comes on site to check on you and make sure you're doing a good job. Okay, so we want to make sure you complete within that 20 weeks, 600 clock hours, and we prepare you for that national certification exam. So we're so excited for you, and let's dive right in. Okay. So, week one, I mean, you will notice we have everything outlined for you as far as what to expect every single week. So, you're going to go through things like the intro to medical assisting. This is kind of the fun stuff, I would say: professional medical assistant in the healthcare system, therapeutic communication, and legal principles. So, this gives you a really good introductory path to say, okay, this is what it's all about. Maybe I didn't know this, maybe I did know this about it. So that's really, really fun. We're also going to introduce you to the computer lab, which you're going to love. So you're going to need access to your own computer, which we have ready to go for you. You will also need access to some earphones because there's going to be some fun interactive videos and things on this really fun platform we have for you that's part of your student kit. And that will be a big part of your time with us. So we'll do that intro to the computer lab and our intro to the medical lab too. So this is very exciting for you. You'll continue on in Unit 1. Okay, another intro to those labs as well on Tuesday. On Wednesday, you're going to continue through Unit 1. You'll see how this changes over every week. And then the hands-on labs are going to be really specific to just a couple fun little procedures, such as using feedback techniques to demonstrate respect for individual diversity, gender and appearance, respect for individual diversity and race. So we'll run you through some fun little interactive activities and just really make sure that you're prepared to work with people. And I mean, as simple as this sounds, this is really fun to go through, and you just would not gain that opportunity otherwise. Interact with your classmates. We'll bring in some fun models for you and really provide these neat hands-on lab procedure activities and really give it 100%, 100% effort, because this is what you deserve, right? When you come into a learning environment. Then you'll notice there on that Thursday, lots of other procedures to include. Let's see here. It's things that you haven't done yet. Let's see. So we have got apply the patient's Bill of Rights. That's important. Locate the medical assistant's legal scope of practice, protecting the patient's privacy. That is huge. HIPAA compliance, completing a release of records for a release of information, performing disease reporting and reporting illegal activity. That's important to know how to do that, and complete an incident report. So before we get into the kind of patient care portion of it, it's important to learn some of these techniques so you'll really get to enjoy that. Okay, you will test on Unit 1 on that Friday. We definitely like to highlight some of these major points to make sure you're prepared for these exams. Now, when we do give you an exam, it's going to be something you're very well prepared for. We're going to go over every single question, every single answer. So don't worry, we're going to prepare you for it, and you're going to be good to go. Then on that Friday, the instructor is going to demonstrate the venipuncture performance as well as donning and doffing. You'll see this quite a bit through the lab. So this will be performed in our laboratory. So we'll give you a good intro of that. So hopefully you see week 1 is easy going, kind of gets you into it so you're not feeling super overwhelmed. A really good introductory week. Okay, week 1. Week 2. This goes into another unit as far as medical assisting, healthcare laws, and healthcare ethics. Okay, still in Unit 1, just a different section of it. You'll continue on in the labs with performing venipuncture here. Okay, you will also continue on with donning and doffing that Tuesday, Wednesday, Thursday, and really making sure you're good to go with performing routine venipuncture with multi-sample needles and evacuated tubes. So you'll get to do this on mannequins and some opportunities where it's not a stressful situation. We want to make sure you feel comfortable with all of this, and you'll see we do this quite a bit. So from phlebotomy to the EKG stuff that's coming up to medical billing and coding, all of that is inclusive in this clinical medical assistant program, which I think is neat. And I hope you can appreciate the level and the amount of labs you receive on those items. So that's what I think is really, really neat. Okay. Then on that Friday, week 2, you're going to test on that section, the intro to medical assisting, healthcare laws, and healthcare ethics. That's really the most important thing, is to really make sure you understand what you do is, important. You've got to comply with the laws, got to comply with ethical standards. So good to go there. Moving on to week 3, we're going to do a little bit more with dotting and doffing and the venipuncture routine. So that is very important. You will then go on to unit 2. This one's really neat because it's the fundamentals of ambulatory care administration, technology, written communication, telephone techniques, which I personally think as someone that hires people all the time, I mean, this is important in any industry, right? Scheduling appointments and patient processing. So that one's going to be a fun chapter to go through. I can't wait for you to see what that one's about. Okay. Then you're going to continue, like I mentioned, with your venipuncture hands-on labs, but then moving into Tuesday here, you're going to prepare workstations. You're going to identify a reliable patient education website. Education is important when you're educating patients in the healthcare industry. Composing a professional business letter. So understanding how to utilize your computer technology, email databases, and systems to compose professional letters. This is a huge thing. This will set you apart. You just have no idea sometimes. I mean, if you're young, you understand. But for those of us that just think, wow, I need a little refresher on computer ethics and how do I do these procedures, we're going to go over that so you feel like you're ready to jump in no matter where you go work. Okay, then on that Wednesday, you're going to test on those items there. So that's nice. You're going to go through these procedures. So composing a memorandum, composing a professional email, telephone techniques, completing a fax cover sheet, simple things. So, some of you may know some of this information, but hello, even if you know it, it's good to have a review. So these are some nice ways to jump into some of the administrative components of clinical medical assisting. Okay. Then you're going to dive into that fundamentals of ambulatory care administration, health records, daily operations, and safety. That's going to be a really fun chapter that I think you will enjoy. Some of these other labs you're going to perform here, these procedures, establishing an appointment matrix. So logistics when it comes to appointment booking. So this is good. Okay. Scheduling a new patient, coach patients regarding office policies, and then scheduling a patient procedure, making these things feel like that person's at home, making them feel comfortable, making them feel like they understand, so you are going to be little mini educators in whatever setting that you choose to be in. And it's probably one of the more important things. I mean, medical assistants are those educators. So let's make sure that you feel confident to do that. Moving on, you're going to then go into more of our venipuncture. So this is important for our phlebotomy techniques. Okay. Moving into week 4, you're going to test on that section of unit 2. You're going to move on here to unit 3, which really dives into some of the meat and potatoes, right, of the CMA program. So health insurance essentials, diagnostic coding essentials, procedural coding essentials, medical billing and reimbursement. So this will be a big chapter. I want you to read ahead for me, make sure you're good to go there. And so we can dive right in. So this is exciting. And then you're going to do more of our phlebotomy techniques. Make sure you are ready to go. Okay, moving on to Tuesday, you're going to continue on with the venipuncture, and then we're going to do some other fun procedures like performing coding using the current manual or encoder. You're going to perform procedure coding for surgeries. You're going to do procedure coding for office visits and immunizations. So that's going to be a lot of fun. So all sorts of different things you're going to get to do in these labs. We want to make sure you are good to go there. You're going to continue in unit 3 for Wednesday, Thursday, and Friday. But some of the other labs you're going to do are registering a new patient in the practice management system. You're going to upload documents to electronic health records. Some of these things we'll do together in your NHA platform on the computer. Okay. So all these procedures, by the way, line up with the KINS textbook. Okay. But depending upon which ones that your instructor finds to be applicable to our NHA platform that you also have as part of your student kit, will kind of tie it up with that. So that's really exciting. You're going to do things like perform a supply inventory, participate in a mock exposure event, very important, as well as use a fire extinguisher. So those are kind of close by your classrooms anyways, but just to be sure that you understand how to run a medical office, you may be in charge. So these are some things that are really important when you're doing this. Okay, you're going to continue on with performing coding using the current manual or encoder. So this is important to continue on with that. And then some of those other things that we mentioned above as well. On Friday, you're going to really dive into various points on the NHA Medical Billing and Coding Simulator. So I'm excited for you to play around with that one in the computer lab. And you're going to feel like, oh man, I'm really excited about this. I do understand it. And you're going to be prepared to jump in anybody's practice. Okay, that's week 4. Week 5, you're going to continue on with Unit 3. It's important to really dive into that chapter in great detail. So that's nice. You're going to move on to getting back to that phlebotomy technique. So performing the venipuncture, but in the hand with winged collection system and evacuated tubes. So that's going to be something a little bit newer. So that's exciting. And then Tuesday and Wednesday, you're going to really get into more of the NHA medical billing and coding simulators. We want to make sure as we're going through Unit 3 in the book that it matches up with the NHA platform. So this is exciting. You're never going to get bored. You're always going to be kind of back and forth between those two things. Always exciting. Thursday, more Unit 3 and more venipuncture, or excuse me, you're actually here, going to collect a blood specimen using a syringe and transfer device, performing routine capillary puncture by finger stick, which is still part of the phlebotomy curriculum, performing routine capillary puncture by heel stick. You'll do that on Thursday and Friday. And I also had one of my, must be around here somewhere. We've also got some really fun phlebotomy textbook content, not necessarily something you have to dive into, but we've got lots of media, lots of resources for you to dive into if you want to make that a huge part of your experience. So we've got it all for you. So that's exciting. Moving into week 3. So the fun thing is you're actually going to get a separate textbook for the anatomy part of this, but also because I've been diving into it myself and very excited for you, the NHA platform has a whole section on anatomy and physiology. Now, this will come into compliance with the newer South Carolina regulations for clinical medical assisting. So they're adding more of the anatomy physiology, and they're adding more of the math requirements to this. So you'll see these kind of highlighted this way in the curriculum to make sure that when we print your lab sheet and your transcript at the end of this, that you can show whomever that you've gotten all this education. So very comprehensive program for you. You'll test on week 6 on that Unit 3. So that's exciting. And then we're going to dive heavily into anatomy and physiology. So whether it's in your textbook or on the NHA platform, we're going to dive into various things to make the learning fun. So this is really key. You're going to go into more of the blood specimens here. So more of the phlebotomy techniques. And then on Tuesday, back to NHA medical billing and coding as well. We don't want to just stop with that 1 week of it. We're going to continue throwing it in throughout. So you'll notice where we kind of sprinkle some of these things through. What I don't want y'all to do is to have something way over here and then not have it again. So you'll see that we go back and forth in some of these areas to just make sure it's a very comprehensive process for you, okay? And then some of the procedures to add to this from your KINS book are going to be interpreting information on an insurance card, performing pre-certification with documentation, and completing an insurance claim form. So we're still working through all those procedures in our textbook too. So that's kind of nice. On Wednesday, more anatomy and physiology. So you're going to respond to a medical necessity denied claim. So that's exciting. You're going to inform a patient of financial obligations for services rendered. You're going to do post charges and payments to a patient account, and you're going to inform a patient of financial obligations of services rendered, post payments, and adjustments to a patient's account. All very important when it comes to the medical billing and coding aspect of it. So while we're continuing to move through some of those procedures, we are also kind of moving forward into Unit 4. Unit 4 has to do with, again, advanced ambulatory care administration, but patient accounts, practice management, advanced roles in administration. So every topic you can think of, we are covering for sure, okay? Then moving on to Thursday, we're going back to that NHA medical billing and coding simulator in addition to anatomy and physiology, as you see there. So lots of fun, various things, keeping it rolling, keeping it exciting. You're then going to test on Unit 4 on that Friday, go back into some more anatomy and physiology, and then medical billing and coding simulator. So you'll have a lot of fun with your teacher, a lot of fun with your classmates. I'll be jumping in there a little bit too to come and help you guys because I always like to be a part of the classroom activities. and you're going to absolutely love it because remember, in those first, 15 weeks, you're with us. We want to make sure you're the expert. And in those last final 5 weeks, our goal is to get you ready for those externship opportunities. And so you see, we are doing just that. Week 7, you're going to dive into Unit 5. So this is exciting. Fundamentals of Clinical Medical Assisting, Introduction to Anatomy and Medical Terminology. So we've already kind of gone through some of that, but you'll kind of see their version of it there too. Infection control, vital signs, physical examination, and patient coaching. I think the patient coaching aspect of it is one of the more important things. I think that, and I'm sure you all agree, that when you've gone into any medical setting, whether it's a hospital or private practice, education is key, looking people in the eye, helping them, giving them individualized attention. So this is where kind of modern day medicine can kind of meet some of these tried and true techniques to really give people the best patient care possible, right? Then you'll notice week 7 is still more anatomy and physiology. You'll test there on that Wednesday. Okay. You're going to do some urine specimen collections here. That's important too. Testing urine with a reagent strip and obtaining a throat culture. So week 7 gets into some new things, which is exciting. That Tuesday, you're going to perform hand hygiene, which you will have done anyways throughout, but just to make sure we check you off on that procedure. You're going to sanitize soiled instruments. That is also important. And all these infection control things you'll learn in the beginning, of course, but we want to make sure that you have that as a checked off moment. You're going to obtain an oral temperature using a digital thermometer and obtain an axillary temperature using a digital thermometer. So more on the kind of technical aspects with the various equipment that's going to be in your lab, which is exciting. Okay. Then I think this is kind of neat. Procedure 16.4 is preparing a bank deposit. I mean, what if you're placed in more of an administrative role? I think that's important to know. Then you're going to do things like obtaining a temperature using a tympanic thermometer. You're going to obtain a temperature using a temporal artery thermometer. And then you're going to obtain an apical pulse, and then assess the patient's radial pulse and respiratory rate. So a couple different procedures there to really get you all set, ready to go for working in the medical world. Okay. And also, as you're moving on to, I didn't mention Unit 5 in the KINS book. This one is going to be Introduction to the Anatomy. And I did mention this one, going into the infection control, vital signs, physical exam, and patient coaching. So yes, Unit 5. Then you're going to dive more into the urine specimen here on that Thursday, test on Unit 5 that Friday, and then you're going to jump into some hands-on labs, so determining a patient's blood pressure. That is very important. We're performing a pulse oximetry, measuring a patient's weight and height. So again, more of that equipment operation in the clinical laboratory, which is exciting. You're going to finish off on that Friday with some more of these items here, that urine specimen, testing it on a reagent strip, and obtaining a throat culture. We want to make sure that you're getting everything possible so you're ready for that externship. Going into week 8, okay? This is another segment of Unit 5. So this one goes into, which I think is cool, nutrition and health promotion. Nutrition and health promotion as far as the surgical, and going into, surgical supplies and instruments, assisting with surgical procedures, principles in electrocardiography, and medical emergencies. So this is over the span of a couple different things, but I think all of that sounds incredible. So we're going to dive right into those. Your hands-on labs are going to be assisting with a minor surgery, applying a sterile dressing, removing sutures and or surgical staples. So again, making sure we continue through those procedures and moving along here too in our units. So it's not just about this textbook, right? This is only one of our tools, but we've also got that fun NHA system ready to go for you too, okay? Then you're going to dive into, and again, this is week 8, you're going to do the electrocardiography, so the EKG. You're going to apply a Holter monitor as well. So this will align with that Unit 5 section there for you too, okay? You will then do a couple of other things just to keep it exciting. So introduce a patient, or excuse me, instruct a patient on dietary changes, wrap instruments and supplies for sterilization in an autoclave, very important, and then operating that autoclave. So we've got a brand new autoclave coming for your classroom. So this will be fun to learn how to utilize that. You'll utilize that in many medical environments. So very excited for you. Okay. Then procedures for that Thursday, performing a skin prep for surgery. You're going to perform a surgical hand scrub, prepare a sterile field using transfer forceps, and pour a sterile solution into a sterile field. So all exciting stuff, making sure you're ready to go. Then that Friday, you'll test on Unit 5. We're going to go into some NHA simulator and lessons. Okay, we're going to dive right into that as it pertains to where you are in your book. So that's exciting. And then we're going to give you a review of performing an EKG, applying a Holter monitor, and then getting back to some venipuncture just to make sure you still got it, right? So this is important to continue with those labs. Week 9. Week 9, I would put a star by this one. So this one, we're going to dive into Unit 6, but then also General Math and Accounting. This is one that I'll come in and teach you guys and help with because I love this kind of stuff. And I want to make sure that you are good to go on the math portion. So we're very excited to do that for you. And again, this is in compliance with the requirements for a clinical medical assistant curriculum moving into this year. Okay. Then Unit 6, assisting with medications, principles of pharmacology, pharmacology math, administering medications, all very important stuff. I like all of that when it comes to Unit 6. Okay, you're going to continue with your EKG here on this day, as well as more of our phlebotomy techniques. Moving on to Tuesday, you're going to assist a provider with a patient exam. We're going to have an on-site medical guest provider with mock patients for you to run through a couple of scenarios. So again, we're trying to get you ready for those really fun externships. So this is one of those amazing opportunities. We do have an on-site physician as well as nurse practitioners that really help us in some other programs. So you might get to meet them as well as maybe some people you might work with on these externships. So we're very excited. On that Wednesday, we're going to perform first aid, okay? Provide rescue breathing, perform CPR, as well as get to know the AED. So this is important. We want to make sure y'all are very, very well versed in those items. So we'll do that a couple of different times. You'll notice this is part of these procedures, but we can definitely dive into that a lot more than just that time allotment because that is so important, making sure y'all are good to go with life, making sure you're good to go with some of these emergency situations and first aid, okay? On that Thursday, general math and accounting again, you're going to coach a patient on disease prevention. Develop a list of community resources and facilitate referrals. So this is where we'll kind of utilize the computer lab and you're going to make your own list of community resources. And this is good. So education is key. Prepare a prescription. Calculate medical dosages, administer oral medications, and prepare medications using a pre-filled sterile cartridge. And then you're also going to reconstitute powdered medication. You just never know the kind of medical environment that you will be in, who you will be working alongside. So having all these things that you've actually done will help prepare you. You'll jump into those externships, no problem. And I can't wait to show you off to all these amazing medical offices. And, of course, you're going to be the best. So we're going to make sure that that's the case. You're going to test on that Unit 6 section. We're going to continue on with general math here. And then that Friday, we're going to go over the first aid items again, make that a lot of fun if we have time, which we may not because that can be very all-encompassing. We're going to dive into a couple more NHA simulator and lessons there as well. Okay, so very exciting. Moving into week 10. Week 10, you're going to start Unit 7, assisting with medical specialties. So this gets into the specialties. So ophthalmology, we've got dermatology, allergies and infectious disease, gastroenterology. You're going to see all those opportunities there. You're going to get to work and feel like you get to know the various aspects of medicine. And in week 10, I mean, this is where you may think, gosh, this is kind of what I want to work on, or I didn't know this about neurology. Maybe I want to kind of go that route. So start thinking about that. I would even say put a star next to week 10, Unit 7, read that one ahead and see what you think. We want to pair you up with the right place for sure. You're then going to dive into hands-on labs when it comes to the venipuncture again. We're going to do more NHA simulators and lessons there as it pertains to where you are in the program. Okay. Tuesday, same thing on Unit 7, more venipuncture and collection of blood specimens. Wednesday, we're going to dive into more of the performing of first aid. So as you will see, because that can be so all-encompassing and we can go through so many various things. I actually want y'all to know how to do resuscitation CPR on adults and children. So that's very vastly different if you know anything about first aid training. So we're not going to rush. You'll see this sprinkled throughout those final weeks there, and very excited again for you to learn that. Okay. That Thursday, more first aid. Friday, test on Unit 7, NHA simulator and lessons as it pertains to those specialties, and then more first aid. Okay. So again, you're going to feel very well versed in that. I'm very excited for you. Okay, moving on to week 11, we're going to get back to some of that general math. Okay, this goes into another section of Unit 7. So more behavioral health, endocrinology, cardiology, pulmonology, urology, and obstetrics and gynecology, pediatrics and geriatrics. So a little bit more specialized there, which is exciting. So you might want to read that section of Unit 7 as well, kind of think about what you're interested in. And then procedures going back to the reconstitution of powdered medications. That's important to do again. Mixing two insulins, administering an intradermal injection, administering subcutaneous injection, and administering an intramuscular injection. So we're going to give you a lot of different opportunities to kind of see what really piques your interest, and you will be very well-rounded. On that Tuesday, we're going to do those same items again when it comes to mixing and reconstituting, administering of injections. Of course, that will pertain to whoever you're going to work for. So we'll say that. You're going to continue to focus on Unit 7. General math, those same procedures. And then that Thursday, Unit 7, general math, you're going to come back to performing EKG again. You see how I mentioned, I want to continue making sure you've not forgotten this content. So we're going to sprinkle that in throughout. And then more of the NHA simulator and lessons. That Friday, you're going to test on Unit 7, more general math and accounting, and then you're going to do more of first aid because that is very important to know. Okay, moving on to week 12, Unit 8 goes into the introduction to the clinical laboratory. So this is exciting. You've already been doing the phlebotomy stuff since the very beginning. So you'll know some of this, but on the theory portion of it, this is exciting. So urinalysis, blood collection, analysis of blood, and microbiology and immunology. So if you are more interested in working in the lab setting, here's the theory behind that. So that's good. You're going to continue to perform more of that first aid. So very important there. Tuesday, we're going to do some hands-on labs in the morning. So we're going to do quality control measure on a glucometer and record the results on a flow sheet. We're going to use an eye wash station, which is important, and you're going to perform routine maintenance on clinical equipment such as a microscope, which will be in your clinical lab. So that's important. Sometimes you may be required to kind of take apart equipment, putting it back together. So we're going to make sure you're prepared there. You're going to continue on with Unit 8 in the theory section, and then hands-on labs. I want you to do some more on the EKG readings. I want you to also do these procedures, perform a microfilament foot exam. You're going to measure vital signs. You're going to measure the peak flow rate and administer a nebulizer treatment. So very fulfilling lab days. Oh man, this is going to be very exciting. On that Wednesday and Thursday, you're going to continue with Unit 8. You're going to see where we throw back in some of the venipuncture, blood specimen collection, all of that, because that goes with Unit 8. So that's exciting. And then more of the NHA simulator on that Thursday. Okay. And then moving on here, you're going to set up and assist for provider with gynecologic examinations. You're going to coach a patient on breast self-examinations, which is important. Okay, moving on to that Friday, you're going to do more of the venipuncture. We're going to align some NHA simulator lessons that pertain to that, of course, which is exciting. And then down here for hands-on labs, you're going to do measuring a head circumference of an infant. Okay, measuring an infant's length and weight, document immunizations, very important, perform preventative maintenance for the hemostatic centrifuge. You're going to perform a CLIA-waived hematology test. So very important, various labs to learn. Again, this all makes you super well-rounded. Okay, we're getting close to that week 15. So here we are at week 13. Unit 8, this gives you some more stuff here, just making sure that we're not moving forward. So Unit 8, you're going to continue on with the clinical lab section there. Hands-on lab, you're going to end up doing the CLIA-waived microbiology test, measuring distance visual acuity, measuring hearing acuity with audiometer, and you're going to irrigate a patient's eye. So those are all very important things that do kind of go with some of the things you've been learning. Then on Tuesday, you're going to do a test on Unit 8. That is very exciting there. You're going to do those hands-on labs again, because I want to make sure that you do understand that. And you're going to make sure that you instill eardrops, irrigate a patient's ear, so some of those things just to make sure you fully understand. Then we're getting close to the end of our Ken's Medical Assistant textbook here. So Unit 9 is job seeking skills and strategies. I'm going to jump in and help you with some of this stuff. Those procedures incorporate very important things such as preparing a resume and creating a cover letter. So you'll see me in this section for sure. Then Thursday, you're going to go back to some more first aid training. That Friday, you're going to do some more of your NHA simulator and lessons. Very important there. And then more first aid. So again, do not feel like you have to understand it every, part. We're going to add to it and make sure it's very comprehensive. So that's important there. Moving on to week 14, we're going to test on that Unit 9, which is nice. And then we're going to do hands-on labs here. So coach a patient on health maintenance. So important. We're going to do a fecal occult blood test, develop a hemoccult card, and perform quality control. Coach patient on health maintenance for colonoscopy. So various things you might be working in. You're going to continue on with some first aid there. On that Tuesday, we're going to really dive in, and that Wednesday as well, more of our NHA items. The purpose of NHA 2 is they give you a national exam, okay? So going through their simulators and their lessons that kind of align with your book help to prepare you for the test. And there's also some really fun test preps and some things to where it's just easy enough. By the time you're ready to take that national exam, you will be very ready, right? Then on that Tuesday, you're going to assist with an application of a cast. That seems fun. You're going to assist with a cast removal as well. Okay. Then on that Wednesday, you're going to coach a patient in the use of crutches. You're going to coach a patient in the use of a walker. You may work in geriatrics or work with, the elderly or people after they've broken a bone. I mean, they might need help with all this. You're going to coach a patient in the use of a cane. You're going to continue with the NHA items that Thursday, Friday. Again, we're trying to get you ready for that final national exam. And then the procedures you're going to perform here are perform a neurological status exam, assist with a lumbar puncture, coach a patient for this electroencephalogram. Okay. And then that Friday, because don't forget, I want to get you back to donning and doffing and more of the venipuncture. Make sure you're very prepared. This is going to make you even more prepared than most people that take a, very short phlebotomy test. You're going to have this sprinkled throughout. You will be beyond prepared. So this is exciting. Then week 15, final exam prep, more donning and doffing, more venipuncture. Okay, you're going to perform an EKG again. I want to make sure you understand how to do all these things. And then we're going to do our clinical lab review that Thursday and Friday. And then final exam on that Friday. So that's exciting. My goal for you is to take that national exam on that Friday, or wait if you prefer, and we will give you an internal final exam to prepare you for it. That is completely up to you. But of course, we want to get you a job as quick as humanly possible here. But then finally, week 16 through 20 is where we set you up for that really fun clinical externship. So get excited about that one. We do monitor that. We have paperwork to make sure that you're in compliance with all of our governing agencies and who monitors those externships as well. So very, very exciting stuff. But oh man, thank y'all for listening. I am excited to have you and join us for our clinical medical assistant program at Southeastern Aesthetics Institute, where we focus on wellness education massively. So I can't wait to have you this year, and we look forward to seeing you.